My philosophy is less is best, but doing nothing when there's a problem is not the way to go because it'll cost a person more in the long run. When I say less is best, what I have extensive experience and background in is first cosmetic dentistry. How could I rebuild someone and create their smile and function so that they eat and chew comfortably? The second thing that I brought together was since 1993 I stopped using mercury in my practice. So mercury fillings, silver fillings that have mercury in them, because it had so much controversy about, is there a toxic element to the mercury? Does it come out? Does it stay locked in there, etc.? So at that point I said, well, I'm going to stop using it and do more research on it. I continued that journey, and then I've gotten very, very deep studies and research into holistic dentistry, how to find materials that are safer for the body, how to remove mercury fillings, silver fillings safely, all these types of things, etc., protecting not only the patient but myself and my staff at the same time, because this mercury does come out all the time, even when it's in someone's mouth. And we'll talk about that at another time, but going back to the philosophy, I took the latest in cosmetics, the latest in holistic dentistry, and then I said, now, what can we do to do things minimally invasively? So I studied all I could on minimally invasive dentistry. How do we rebuild teeth as close to nature as possible? And there is a way to do it. And I'm part of a small group of people that were amassing all the data, and we continue to study that and bring about the latest and the best things in it. Long ago, what we've been doing for the last 130 years, for example, someone comes in, they crack a tooth. So we're taught, even today in dental schools, we're taught, oh, well, we have to grind the tooth down, the whole tooth, and put a cap over it to keep that from cracking further. Now, when you look at aviation, if there's a crack in the wing, they don't just put a little bonding over it. They actually chase the crack all the way down, and then they put the bonding just beyond the cracked area and build it all the way back up. I'm like, wow, okay. So what we find in dentistry, for example, if a tooth is cracked, you put a crown over it, the crack continues to propagate down, even with the crown. So over a period of time, many of those patients can end up needing root canals and things like this. So what do we do with minimally invasive dentistry? We chase the crack down, we rebuild the tooth, the inside of the tooth, with a bonded material, and then we just cover the very surface with porcelain, which mimics enamel. And then we haven't whittled down the whole tooth. Isn't that awesome?